Television. 2 minutes to the top of the hour. We're talking live with the Cabinet Secretary for Health, Mutahi Kagwe, and I tell you, man, it's a thankless job, I guess. It's thankless, and you coming from the private sector into the public sector must be a nightmare.
Well, yes and no. Yes and no, Jeff, because don't forget that I've been there before. I've spent my life in the public sector. I have done the private sector. I've even done a slightly different one, which is the academic sector, which to me falls in neither, kind of. It kind of falls somewhere in the middle. Each of those sectors have got its own challenges. The thing about the public sector, the difference between the public sector and the private sector, is that in the private sector, it's mine and it's yours. You have a dog in the,
Yes.
you have a dog in the show. But I think that the problem with the public sector is the attitude of, I don't have a dog in this race. All right? If it doesn't happen today, it can happen tomorrow. The government, you pay the salary anyway. In the private sector, you don't have that luxury. But I can tell you one thing, Jeff. I have also been fortunate to work with fantastic people in the public sector. Reformists in the public sector who want to work, and as long as they are provided with leadership. And I have seen it even as I speak in the Ministry of Health. I have seen people spend nights there working away, to produce documents that must be done. So it isn't that it cannot be done, or that the public sector does not have its own strength. It's got its own strength. But remember, you're talking about public money. That's why you get in situations like KEMSA. And sometimes it's a totally innocent situation. And then you get yourself militarized by politics, which is very rare in the private sector. So the enemies of development, so to speak, are many in the public sector, not least bureaucracy. So bureaucracy is one of those cases I was referring to earlier, where because you are trying to stop certain things from happening, you want to make sure that public resources are used properly. You have created a certain bureaucracy. But that bureaucracy in and on itself becomes an enemy because you just can't get stuff done. But I can tell you also another thing. I can also add one more thing. I think that leadership is crucial. Support from the system is crucial. And I can tell you that one of the reasons why the health sector is moving quickly, building hospitals in Nairobi and elsewhere, and the speed at which we are moving at the Ministry of Health is essentially because we have got the support of the President himself. And the President has a passion for this sector. Spending, hours on end, talking about health, doing things in health. Reforming the health sector is one of his 4 agendas. So because of that, the support we have from the government, and not just the Ministry of Health, in a multi-agency, multi-ministerial sort of approach, is assisting us to make reforms. But yes, you are right. The public sector is not the private sector.
And I know it's not your first time, obviously, to be Cabinet Secretary or Minister. In 2005, you're Minister for Communications, right? Information Communications.
That is correct.
Is it different this time around?
No, not really. Not different. Obviously, it's 10 years. It's been over 10 years. So things have moved on and things have changed. In fact, if you ask me, the challenges that we had in 05 and 06 and, and 07 when I was in the cabinet at that time were perhaps even more. Today, we have got efficient communication systems that we can use. Then there are areas where the challenges might be more now than then. It depends on the political scenario. At least in those days, you work and we are working together, moving together in a sense. But now you have a situation where you even there is political operators who are willing to weaponize anything, including weaponizing COVID and deliberately making you look bad for political purposes, not for anything else. And therefore, and we are in a very democratic country, and democracy has got its own costs, as you well understand. So, Jeff, there is no hard and fast rule. Politics changes, but yet the funny thing, it is funny how it changes, yet stays the same.
The more things change,
the more they stay the same.
Let's go to some tweets, see if anything has changed in the last hour or so, Waziri. Oh, SMS first, okay. Anonymous doctor says we have lost several HCWs to COVID-19. Most of those bills we are contributing to foot bills, okay. What is CS's opinion?
Well, as I have said, as I have very clearly said, the health care workers are my first priority in terms of protection, and that's why I talked about this thing that was announced today in terms of protecting them. But I also said that healthcare workers are also part of our people. We have lost teachers, we have lost politicians, we have lost other professionals, we have lost engineers. So we will not escape. We will not escape. The important thing is to make sure that we have done everything we can to mitigate those deaths and to make sure that we don't lose anybody that we couldn't have.
What about those doctors who say it's like going to fight Al-Shabaab without the kit, without protective gear, without guns?
Everybody has protective gear. In fact, chances are that most people would get the disease outside the hospital than in the hospital.
Noah Kiptala says politicians are going around with BBI in 2022 politics as if COVID-19 doesn't exist. Does it bother you? And if all of them from the very top, the president, deputy, former PM, must talk about mass gatherings.
Every mass gathering bothers me. May it be political, may it be religious, may it be a wedding, may it be a funeral, because there is no difference between a funeral of 4,000 people and a political gathering. There is no difference between a religious organization or a kanisa that's going on with 3,000 people than a 500 people political gathering. They are all wrong. Let me be clear. There is no gathering that is correct. All gatherings, particularly those that are not observing the protocols that we have set forth for any sort of gathering, is wrong.
James Courier says, yesterday in Parliament, the MP for Kwanza constituency, Ferdinand Wanyonyi, was pushing for a standby helicopter to evacuate MPs. Does that make sense? Is that tenable?
Well, you know, we have got all sorts of arrangements. I mean, for example, AMREF has got evacuation facilities, not for a specific person, not for politicians, but for patients generally. So unless Parliament itself were to provide a separate system for themselves, which they can, if they wanted to, you know, have a shopper and to protect their own people under their own insurance, then that can work. But at this point, what you'll be looking at is not a class of people or a set of people. It's Kenyans generally.
Okay. Yvonne Atiedo says, the cost of treating COVID-19, whose burden is it? Is it an individual citizens or the governments? Insurance companies are shying away from footing COVID-19 bills. NHIF too, I think you explained a little earlier.
We spoke about that.
Yes.
We spoke about that.
Yeah.
But let me also add something, Jeff, on this one. Let me say this. You know, if you are told not to walk into a hole, you know, if you are told that's a hole you are walking into, and you walk into the hole, and you fall into the hole that you have already been told you are walking into a hole, and you walk into the hole and fall into the hole, you cannot be in the hole and then start telling Jeff, why are you leaving me in the hole? I told you, you are going to fall into the hole. All right? So the first thing to do is to protect ourselves so that we don't get COVID-19. But once we get it, as a government, we have to take responsibility. But I'm just saying, let's be fair. Protect yourself first. If you go to a political rally, for instance, and we have told you, don't go into that political rally, then you fall sick. Then you start saying it is the government that I'm in a hole now. Government, come and take me out. There is some equation there, and I'm sure you agree with me. There's an equation there that is wrong.
Yeah.
You take care, but remember, the first line of defense is you're following the protocols that we have set forth.
So we're walking into that hole?
Don't walk into the hole.
Okay. Nicholas Karich, is it also possible that allegations of corruption left the Kenya population annoyed and unsure whether the pandemic was real or just an opportunity to make millions? We talked about that too.
We spoke about that. But you see, for me, look, Jeff, if you told me that there is corruption in Citizen TV, you know, and therefore should I save my life or not because there's corruption in Citizen TV, I'll save my life and then worry about that nonsense later.
Wow. Enough said. This is Twitter now. Twitter. Joseph7 says, ask CS Kagwe what his ministry has done to audit counties' COVID-19 response. Kwa vile kwa ground, vitu ni different.
This is something that we have done. Today, I received a report of the committees that I have set from the Ministry of Health, made up of the chairman of our institutions, led by Eva Jenga, the chair of the council. I received a report today about the actual ground position that exists in the hospitals. We have given money there, and therefore we expect certain results. That's why I sent a team to the entire country to go and assess each medical institution, to come back to me and tell me what the position is. I have also appealed to the Senate, because the role of the Senate is to oversight counties, specifically to oversight counties as far as government money and what we have given government is concerned, and the activities thereof. We have also appealed to MCAs. We were with them in Mombasa, and I said, look, it is a role of the county legislatures to also oversight expenditure, in the counties, to ensure that money meant for health, money meant for COVID-19 is spent for that purpose. And some counties, I can tell you, Jeff, have done extremely well, but some counties have really let us down.
Okay. Agatha Sergio say UHC is one of the president's agenda. Kindly ask Mutahi Kagwe what are his plans with the recently employed personnel under the UHC program in different counties. We have been having challenges like untimely salary payments, NHIF arrears, no medical CVRs.
I want first of all to apologize to those health workers who might be working and have not been paid. As you know, we made arrangements where we transferred money for UHC workers to their specific counties and a specific number. We said each county is allocated a specific number of people who are supposed to be paid by those counties. Now, some counties went and hired the exact number and they have been paid. Some counties went and hired more people than they were ever supposed to, which means that they were over and above the budget that they were supposed to be spending. So we have asked counties, now that we have given you the money that you were supposed to be paying for the number of health workers that we allocated you, now you look for the money and make sure that all health workers have been paid.
So they top up the difference?
You have to top up the difference.
Okay. Caesar Kingori, Mutahi subscribes to social democracy. Ask him to explain the direction he is taking the ministry in regards to radical changes and social impact the changes will have on Kenyans.
I think it is clear to us when, for example, we talk about NHIF and what we want to do in covering UC and ensuring that level 2, level 3 hospitals have all got the kind of environment that everybody would like to go. The reason why we are having a lot of these challenges, Jeff, is because the referral system, where, for example, at Odhaya or Kenyatta National Hospital or Kisumu Hospital, you are supposed to go there once you have been referred by a hospital that is a smaller hospital than that. What has been happening is that Kisumu Referral Hospital has become a primary healthcare institution. It should not be like that. So in order for us to succeed and in order for us to have proper universal healthcare, we must go back and ensure that the small hospitals are catered for, the small hospitals are well funded, so that a lot of the diseases can be taken care of at that point. And then we can leave the Kisumus and the Kenyattas for referral work, so that they are not too busy with primary healthcare issues that are supposed to be dealt with elsewhere. But it is more than that. It is not just a question of, as I said earlier, and I think I alluded to the issue of prevention. We must deal with prevention as a serious issue in universal healthcare. Family health at the family health level is a huge part of this whole thing. Jeff, if I remember correctly, when we were kids, I would see healthcare workers coming to our home to talk to us and check whether we are okay. There used to be healthcare workers who would come and look at, take care of pregnant women at homes so that they don't have to go to hospitals. So one of the things that we intend to do is to take healthcare home rather than bring people to hospitals. And I think that's a fundamental change in terms of family care management.
Would Mutahi Kagwe walk into any hospital in Mukurweni or Tetu or Othaya? Would you do that?
Absolutely. Absolutely. In fact, I can tell you now that Othaya Hospital, for example, has been upgraded substantially. Today, if you had a problem of COVID-19 and you went to Othaya Hospital, you get oxygen. This is new. This is completely new. So let's also celebrate the things that we are doing that are good.
Very good. Jerosh Odera. Majority of referral cases go to K&H, but apparently there's only one triage room with a very long queue, and blood test results takes between 2 and 4 hours. This is so frustrating. How do you intend to solve these serious issues?
I think I've just said that. I think I've just said, you know, this is a referral hospital. Kenyatta is a referral hospital. If it's a blood test you want or something like that, you shouldn't be in Kenyatta National Hospital. You should be somewhere else in a much smaller hospital. And that's why in Nairobi, for example, we have built 25 new hospitals. 19 hospitals we started building in October. In all the densely populated areas, in Mokoro kwa Jenga we have 2 hospitals, a level 2 and a level 3. Kibera we are building 2, a level 2 and a level 3. Ishaurimoyo we are building 2, a level 2 and a level 3. Every densely populated area. Kawangware is going at level 2 and level 3. So kwa Ruben, we have got a hospital there. So the reason why we are doing all these things is to ensure that primary health operations are carried out in those hospitals. And they are going to be good hospitals so that we can address this thing that that gentleman is asking about.
By the way, General Badi was on the bench a couple of weeks ago. He said the exact same thing.
That is exactly what we are doing.
25 new hospitals.
That is correct.
In Nairobi.
That is correct. And we invite the media, go around, check what I have told you. That in those areas, in about eight densely populated areas, you will find there will be 2 hospitals in each one of them.
Ghost Muri says, ask the CS Mutahi Kagwe if the government will cover the treatment fee for our pupils and students in school. If they will, why not cover doctors too?
Well, I think that's overtaken by events. We have covered them.
There's one more SMS? Okay. Paul Isana. One last SMS, and then I have one more question before we wind up. Anonymous, does the emergency COVID-19 line still function?
As far as I know, yes, it does.
Star, are we calling? Was it star 791?
Let him call and then call us back.
Was it star what? Was it star? 719, yeah.
Yeah, 719.
Okay. Tupige.
And as far as I'm concerned, it works. Now, the point, first of all, you should not call us an anonymous. It's because I can't reply to you if you are anonymous. Hello?
Oh. You have not pressed any key. To continue in English, press 1. Kuendelea kwa Kiswahili, bonyeza mbili.
Well, at least you're getting an answer.
But a lot of people have complained about this line, huh?
Well, that's good. Well, that was some of the reasons why we come here, Jeff, is to know something like that, because obviously sometimes it's not aware if it is not happening. Right. But as far as I know, a lot of people also have had help from the number. But of course, perhaps because of the hour or something, but I know that it works.
Okay.
Yeah.
We'll continue checking, won't we? Look, before I let you go, you were MP for Mukuruweni.
That is correct.
You were Senator for Nyeri County.
That is also correct.
You ran for governor, you didn't quite make it.
Yes, I actually ran for nomination for governor.
Okay, nomination, yeah. I stand corrected.
Yeah.
So what position are you going for in 2022?
Oh, well, Jeff, you know, I'm so busy managing COVID. I'm so busy just carrying out reforms in the health sector. I haven't had time to think about that.
Ah, come on.
And the point is, and Jeff, the point is, you know, as far as I am concerned, if you can provide service to Kenyans at whatever level, that is what you should do. And for me, right now, I'd rather just do what I'm doing. Politics will come. But right now, let me manage health.
And you are?
I'm doing my best.
And you get it?
Totally. Do you?
I get it now. Waziri, thanks so much for your time.
You're most welcome,
like I said, you're a busy man and you don't do these interviews live, and it's tough getting. You've been trying for like 4 or 5 months. You know that.
I am so sorry, Jeff. I totally appreciate. Believe me, no. It is not out of spite. It's just that it's been busy, and it is still busy. but we must also keep on informing Kenyans and trying to carry Kenyans with us.
Okay, look at them right now. They're here in this camera. Look at them. Talk to them one last time. Just reassure them.
Kenyans, we can win this war. Let's work together. Let's move together. Let's create our own army to fight this disease. We can win it. We can win it. Let's do what is necessary. Let's arm ourselves with the protocols that have been given. The weapons are distancing, washing our hands. These are simple things. Sanitizing. These are simple things. Keep your distance, wash your hands, wear your mask. And with just those things, those 3 weapons, alongside the other protocols that have been given, we can win this war. Let us save each other's lives. You save my life, I'll save yours.
You know, it sounds like such simple things and people just don't listen, right?
Correct.
Wear a mask, sanitize, wash your hands, keep your social distance. Sounds so simple. But thanks for reinforcing it.
Thank
and we'll
you.
keep doing that until the cows come home.
That is the way to do it. Don't give up. Don't give up, no matter what. Even if you get people who are not listening to you, don't give up. Eventually, they might. You know, is it Saul who turned to Paul?
Yes.
Yes, it happens.
The Damascus moment.
It happens. So let's pray for more Damascus moments.
Let's pray for more Kagwe specials.
Yeah. That too. After COVID.
Health Cabinet CS Mutahi Kagwe. What a guy. Thank you so much, CS. Thank you.
You're
and thank
welcome.
you for being
You're
a part of this show. You know, if it's Wednesday, it's all about those 3 letters on the keyboard that follow each other. JKL. Thanks so much for being a part of this show. Keep tweeting at Koinange Jeff at Citizen TV Kenya. Hashtag is JKLive. Have a good night, everybody. Good night. Good luck. And God bless you all. Do you wear a mask now? Do you do it now? Or?
Yeah, now put on your mask.
Okay, so.
Assuming I can find mine.
Thank you, sir.